Autonomy and amniocentesis.
Introduction and literature overview.
The word autonomy is most practically explained by its Greek definition as self-rule. When used as a bioethical principle, autonomy means that an individual is free to make all decisions independently and free from the control of others. This can be further broken down into the two most essential conditions for autonomy. These conditions are liberty, the independence from controlling influences, and agency, the capacity for intentional action. Agency means that the freedom to decide applies to individuals with the capacity to make their own choices, or in other words, they must be considered competent. This means that in order to make an autonomous decision, the patient must not only be informed of, but must also understand all treatment options, consequences, side effects, and outcomes. The patient must have enough information to provide informed consent. Amniocentesis is a prenatal diagnostic exam in which a large needle is inserted into the abdomen to retrieve a sample of the amniotic fluid. The fluid is then tested among fetal cells in which there may be chromosomal abnormalities. Before doing any research, a woman may simply do a mamamia.com.au search and find that there are multiple for and against sides towards prenatal diagnosis. Some found it beneficial to know their child had Down syndrome before he or she was born, and others believed amniocentesis was not the best option. This then presents three crucial arguments provided in further research. First, the definition of autonomy given by Eileen Morrison supports the claim that women have the autonomous right to decide whether or not to perform amniocentesis. Secondly, some believe that while a mother has the autonomous right to make her own decision, the unborn child has fetal right too, since the fetus will eventually develop into a being. Yet, people argue that a fetus does not have the same set of rights as an adult. Lastly, but not least, according to the Genetics Research Group of the Hastings Center, the use of amniocentesis for sex choice is discouraged but not illegal. A woman's autonomy allows her to decide whether to continue her pregnancy or abort the fetus after receiving results.
Critical analysis.
A mother's choice. The first instance of autonomy regarding amniocentesis is the very basic opinion that an expecting mother has a right to decide whether or not to have the procedure. As previously stated, this means that they have liberty, the independence from controlling influences. A doctor will suggest amniocentesis if there is a family history of genetic diseases, an abnormal maternal screening test, the mother is over the age of 35, there are risks of sex-linked genetic diseases, or there is an open neural tube defect. Doctors often suggest that the procedure is not worth the risk if there are no signs that the child may have a genetic disorder. However, autonomy means that a mother has the right to request amniocentesis even if none of these indicators are present, and has the right to decline the test even if they are. A mother has the liberty to have the test if only for the reason that it will put her mind at ease, and the liberty to decline if she does not want to assume the risks of the procedure. Some can argue that because a doctor has superior knowledge of the medical risks, it would be their decision if the patient needs amniocentesis. We must also remember agency when regarding a mother's decision as autonomous. This means that she must understand the age and procedure-related risk, clinical implications of chromosomal abnormalities, the need for complete counseling by a certified genetic counselor, and the patient expense of $600 to $1,200. In order for a mother to provide informed consent, she must understand all of these factors and how they relate to her situation. This would mean that they are informed enough to make an educated decision for themselves. Who has the right to choose amniocentesis, the woman or fetus? Although the fetus is unable to physically make the decision for itself, doctors could act on its behalf. The principle of autonomy gives people the ability to make choices in areas that affect their own bodies without interference. However, the amniocentesis procedure has an effect on both the mother and child. According to Susan Goldberg, an assistant professor of law in the U.S., technology, including the use of amniocentesis, has pointed toward the idea that the fetus is a separate patient from the mother. The problem is that access to the fetus necessarily involves invasion of the woman's person, and therefore this creates a genuine controversy over whether a pregnant woman has the right to refuse treatment deemed beneficial to her fetus, says Goldberg.
Some believe that while a mother, just like any other person, has the autonomous right to make her own decisions, the unborn child has fetal rights too, since the fetus will eventually develop into a being. Yet people argue that a fetus does not have the same set of rights as an adult. In some cases, though, since amniocentesis is becoming more widespread, an expectant mother may be found liable if problems result and she did not obtain testing when her health professional suggested it, or when it was generally recommended. If doctors were to disregard a mother's wishes to not have treatment, that would be ignoring the principle of autonomy, and that is why doctors are instructed not to do so. Goldberg makes a valid point when she states that while the consequences of respecting a mother's rights to refuse treatment may sometimes yield tragic consequences for the fetus, the woman, or both, no alternative exists that does not diminish the autonomy of the woman and place pregnant women in a less protected status than other adults. Ultimately, although there are two sides to every argument, Goldberg points out that while there may be some tragic results when a choice is made, the decisions regarding treatment of a pregnant woman to benefit her fetus must be left to the woman.
Amniocentesis provides important genetic information such as chromosomal abnormalities and the sex of the fetus. After having amniocentesis, the pregnant woman has the right to choose what to do with the results after the procedure. She may abort the fetus or continue her pregnancy. The definition of autonomy stated earlier reaffirms her right to decide what to do with her own body. If the doctor provides the results and explains them to the patient in layman's terms so that the patient may fully understand the health of the fetus, then the patient may make an educated decision about her pregnancy. In a study done in Denmark by Philip and Bang, 1,177 women were examined by amniocentesis for chromosomal abnormalities. 26 women decided to abort the fetus after receiving the results of the procedure. Out of the 26 women, 13 found out that their child had chromosomal abnormalities, and another 13 found out that their child either had an X-linked disease, maternal diabetes, or another serious health condition. The use of amniocentesis to discover an abnormality in a fetus is encouraged, but as stated by Dr. John Fletcher, a woman's autonomy and personal responsibility are the standards that govern the final solution of conflicts about reproduction and abortion. The Supreme Court decision in 1973 that legalized abortions respected women's autonomy, and Beauchamp and Childress say to respect autonomous agents is to acknowledge their right to hold views, to make choices, and to take actions based on their values and beliefs. There are many people who do not agree with Dr. Fletcher and the Supreme Court decision, and they argue that a mother's choice can actually violate the fetus's autonomy, since a fetus cannot make the educated choice whether to live or die.
Discussion.
Once amniocentesis is performed on the expectant mother, the test results will take anywhere from a few days to a few weeks to be processed. The autonomy of the parents presents them the option to terminate the pregnancy or carry the baby to full term. Since amniocentesis is executed during the second trimester, there is a time constraint that the expectant parents have in order to make the decision. Some doctors choose to inform the patient over the phone, and they are not given the same depth of information as in person. When the patient learns the results, they are only given a few days to decide if they want to terminate the pregnancy. Is that enough time? In order to make the decision, the patient needs to be informed of all the risks and factors of the termination procedure and raising a child with chromosomal abnormality. Within this time period, there is an insufficient time for the expectant parents to fully understand the procedure. The patient is not able to consult with the doctor multiple times and/or seek multiple opinions from other health professionals. Another factor that impacts the decision is that the expectant mother may show high levels of anxiety. Before the doctor accepts the patient's choice, they must make sure that the expectant mother fully understands the impact of their decision. In conclusion, the expectant parents cannot possibly weigh all the risks and factors in a few short days and be fully educated, resulting in the patient not having full autonomy.
Expecting parents choose to go through amniocentesis to identify if a fetus has chromosomal abnormalities or to determine the sex of the fetus. According to Fletcher, there are two types of parents who ask for the sex of the child: those who are trying to identify a sex-linked hereditary disorder, or those who wish to select the gender of their next child. Fletcher also argues amniocentesis is a scarce resource in the light of the total number of pregnancies at risk. Thus, requests for fetal sex identification would delay the procedure for women who are actually high risk and are seeking to find out if their fetus has a disease. Since the procedure is a scarce resource and also carries many risks such as death to the fetus, the doctors must determine which patients to accept. But how can a doctor choose which patient to see first? And do the women have to say why they want an amniocentesis? Denying a woman the right to have a procedure that she requests violates her autonomy. Fletcher argues that even if a doctor does not agree with the request for fetal sex selection through amniocentesis, it is fair to grant it within the limits of availability. Dr. Kazazian said that in his clinic in America, they refused to accept patients seeking fetal sex selection up until 1978. Now couples are required to go through counseling before getting the procedure. Counseling is necessary because it provides all the information about amniocentesis, the benefits and risks to the mother and fetus, and the scarcity of medical resources available.
There are quite a few professional issues at stake in terms of amniocentesis and the patient's role in making decisions. Firstly, women should be able to ask their doctor any question they want, however many times they want, and expect to get an unbiased and honest answer each time. It is possible that physicians overemphasize and dwell on the negative aspects of chromosomal abnormalities. Physicians may also then urge women to seek termination. Secondly, women are entitled to a reproductive choice when they are expecting. It is a physician's ethical duty to allow the patient to have full choice. So does this mean physicians should offer prenatal diagnosis or wait for the patient to ask first? A study done in Sweden recognized that 75% of women who were offered the test found it difficult to refrain, and they felt free from external pressure. However, still felt they had an obligation. Women could even feel irresponsible and receive less sympathy from others if they don't get the treatment and have a child with abnormalities. Lastly, there are some risks to amniocentesis, such as miscarriage, rupturing of the amniotic sac, and puncturing of the baby's head. In this case, it is the autonomous decision of the patient. However, the physician has an ethical duty to non-maleficence. Above all, do no harm. In this situation, where and when should the doctor step in and hinder the patient's autonomy? Recommendations and conclusion.
Regarding the ethical, clinical, and professional discussion topics previously mentioned, these are some recommendations that our group has prepared. 1. We suggest that nationwide, every medical facility should be required to provide the prospective patients of amniocentesis with a pamphlet detailing the necessary information for before, during, and after the procedure, as well as what it would be like raising a child with a chromosomal abnormality. After thoroughly reviewing the pamphlet, the doctor should require the women to sign a statement signifying that she fully understands the procedure and its after effects. Among other reasons, this would allow the women to have the maximum amount of time possible to process the potential outcomes, since there is such a time constraint after the results have been revealed.
2. Since there is a scarcity of medical resources, patients should have a recommendation from a health professional stating that they are at risk for a chromosomal abnormality before they can partake in amniocentesis. However, the patient would always have the autonomy to request a recommendation. 3. We suggest that during consultation, patients should have the autonomy to request another health professional to be present in order to avoid a biased opinion. Some questions to facilitate our discussion include: 1. Although the mother has the autonomy to control what happens to her body, should anyone else have the authority to challenge her decision? And 2. Should an expectant mother's autonomous right outweigh the physician's ethical duty of non-maleficence?
References.